Thanks for joining me, Aaron. This is a conversation that I was looking forward to having with you because what I've seen over the past couple of years is the relationship that hospitals have with their websites is evolving a lot. And right now, there's a lot of kind of different forces that are impacting, how the patient experience is evolving, how hospital websites are evolving. And this conversation is all about looking towards the future. What's the next 3 to 5 years for hospital and health system websites? So just a quick intro about myself. So I'm Brad. I'm CEO of Symmetrix. We're a digital agency. We've been around for 21 years, and what we focus on is helping our clients maximize the lifespan of their healthcare website. So getting that asset, to a better level, really extracting the most value that they can out of their existing website, or redesigning or doing improvements onto the website. So it's all about websites on our end. So maybe Aaron, you can, before we jump into the conversation, intro yourself a bit.
Thanks, Brad. I appreciate you having me. It's great to talk with you. So my name's Aaron, and I'm a digital experience strategist. I've been in healthcare for the majority of my career. Spent 17 years at Johns Hopkins, and my role has always been focused on thinking of the broader experience. How are people, coming in as consumers, transitioning to patients, interacting with health systems, and ultimately getting connected kind of people to people, right? A patient to a physician, or whatever the case may be. So I'm excited to talk with you today.
Yeah, pretty cool. So you've been in, I think one of the health system at Johns Hopkins has been innovative, and pushing the forefront of all that. So I'm glad that you're here to kind of help us think about the future of where the web is going. So maybe if you could kind of give me an idea of, before we flow into the future, what's been your experience over the past 17 years? What the evolution that you've seen, over the past, decade and a half of how people interacted, or actually the health systems themselves considered the website, as a tool, and what are they doing now, like from your experience?
I mean, I think the biggest challenge in a lot of health systems is kind of breaking out of the mold of the organizational framework, right? Of how care is provided, and the many kind of specialists that can be involved in that. And so, I've always tried to approach the website in a way that is more about the experience, and focused on what's the topic, what's the problem that they're trying to solve, what's the service that they're trying to access, and how can you just kind of create pathways that ignore the organizational framework. And that's always a huge challenge in healthcare. I mean, any website in any sector is a reflection of the organization behind it. And so, changing to that kind of consumer focused mindset is especially challenging and interesting in healthcare.
And so that's the transition you've seen from kind of focusing on the practitioners, the clinicians, and stuff like that, and how they see their own kind of organization internally, and kind of having a structure, I guess, of the website and menu reflecting that, to, I guess, more of a patient centric. Like, this is the actions I want to accomplish. I want to book an appointment. I want to figure out, where the locations are, kind of a thing. That's the transition that you've seen over the past 15 years or so.
Yeah, and I think, every physician that you work with, every executive you work with, there's kind of a level setting. Where are they in thinking about the consumer? When I think about how maybe I was building a website, 17 years ago at Hopkins, um, things were still very much siloed, even on the web experience that we were creating. And we were trying to think, like, what's the connective tissue between each of these departments or these doctors? And at that point, um, we had a very flat website, and a very large website, and that's continued. And we always relied on taxonomy to lead people, say, from a health topic to the right physician, or to a treatment page where they could learn more about it. Um, in more recent years, the information's become more consolidated in a lot of ways, more question and answer oriented, and in that way, a lot more consumer centric. Like, there's a lot more awareness of, I think, how people are engaging, not just on your website but beyond your website. the importance of reaching people where they are, whether that's in Google, it's social,
Nope.
it's in chat, wherever
Sorry.
that might be.
Yeah, I definitely, see that transition happening. And uh, one of the kind of big moments over the past, years has been that kind of, I think COVID was a catalyst to kind of getting a lot more attention, I think, to the website of hospitals and health systems and stuff like that. And, from what I understand, your team was also at the forefront. You've done a lot of thought around, creating that content, and it was part of, you know, the visibility of John Hopkins went way up because of the fact that you had, content that was timely and authoritative. What do you think was the impact of focusing on that content, on that connection of that content, that taxonomy on, the evolution of how the web was considered?
Yeah. So one, it was very helpful internally, to demonstrate the importance of the web as a platform. It gave my team a real opportunity to lean into our strengths. We're fortunate at Hopkins because it is such a prominent brand that we've always been able to lean into a goal to, provide information around the world, whether people choose to come to Hopkins or not. And so we have a really strong content team that is always, listening, trying to understand how can we rank at the top of Google, what kinds of questions are people asking. And at the time of COVID, um, we were in a really fortunate position in that our website had always performed really strongly on infectious disease content. When the avian, bird flu had happened several years before, we built a small microsite and just seen that we could dominate in that space. And we came to understand there was a lot of opportunity. So I remember my lead content strategist stopping me in the hallway in November of I guess that would be 2019. And saying, "Hey, there's this thing called coronavirus. I feel, we should write some content about it." Yeah, yeah, sure. We're like, that sounds cool.
Wow.
Um, and then, we posted that in January, and it was really just one page of the website. It was fairly extensive content. It was probably 400 or 500 words, answering a lot of basic questions that were, fundamentally, what is coronavirus? And in March, when we really were transitioning to like, oh my gosh, this is huge, right? And you're having this crisis communications meetings, and we're looking at our web data and we're like, wow, we're number one on these searches
Wow.
right now. So we were really well positioned from the outset. And then we had the benefit of, for the only time in my career, and probably everyone in health systems would, knows this, like suddenly the entire organization is focused on one thing.
Right.
Um, and that allowed us to really engage with a handful of key leaders, and they had very specific communication needs. We were able to mobilize around that. We were able to keep coming to them and say, yeah, this is what consumers are asking right now. And to just produce all of this content in real time that helped us to just maintain that position and provide that kind of value around the world. So that was a huge opportunity for our team. At the same time, it also, we saw the impact of the opportunities for telehealth, right? And the importance of that. And we were able to support that team in rolling out greater telehealth capabilities, and just making sure that we were, producing the kind of operational content that helped guide people towards that telehealth when the time was right for that.
I think that kind of, what we're talking about here is kind of touches on, I think, transitioning towards now this future, right? I think those are the two big trends that I'm observing, and you're probably observing, in the sense where right now I think what's worrying, health systems and hospitals and stuff like that right now is those are two of the elements. One, that telehealth aspect is now kind of, there are separate, one-stop shop telehealth organizations who are, you know, it looks like an app. It works so well. People are kind of referring directly to that as opposed. It's kind of a competition, for the hospitals themselves. And then the other aspect you were talking about, all that content, and I mean, obviously, John Hopkins was able to get to the top there, but now with Google switching over to AI, and it's referring to, again, your side, I think, is being one of those kind of singled out as the reference that they're going to be using, but it's only a handful of them. And over the past, 10, 15 years, so many hospitals have and health systems have focused on, hey, let's create content because the content's going to drive the SEO, and the SEO is going to drive people to our website. And now, the stats are that, 80% of health searches are answered directly, in the Google summary. The drop in visits on healthcare websites has gone down like 30% over the past like 6 to 9 months. So I feel there's a lot of change happening around that, where there's these external pressures without even considering political pressures, right? But how are hospital websites going to be rethought in this world where maybe content isn't, or like at least top level kind of more informative content is less important, right? Like what happens to the marketing team? Is there going to be less content writers? Are we going to be more focused? And then how do we compete with these telehealth providers? Is it by using a third party kind of white label telehealth within the hospital? So I think these are kind of questions that I have. I don't know if you have any insight on what you've seen in that front.
Sure, thanks. Maybe let's talk telehealth because we talk web, I might get a little lost in that. Maybe when I think about telehealth, I mean, one, you need to meet the consumer's need for quick access to care, and so telehealth, of course, is incredibly appealing in that regard. And those third party solutions are really great for a health system to get that up and running and to provide that service. At the same time, we see a lot of data and that consumers want PCPs who can help quarterback their care, who can help provide access and help navigate particular health systems in their region. And so, I think there's kind of a marriage between telehealth and expansion of PCP services that kind of goes hand in hand in that.
And just, sorry, like PCP, just to be clear on what that refers
Yeah,
to.
yeah, it's a primary care physician.
Okay, right, right.
And so a lot of health systems are really embracing either, employed or non-employed primary care physicians in the States. And, with the goal of them, being the generalists who are bringing people in, providing that routine care, but also having the referral capabilities to send those patients into the system when they need more specialized care. And, when you think about, I'm sure we've all engaged with telehealth at this point. There's times when it really meets your needs, and there's times when it really doesn't, right? And
Mm.
so if you're sick, and you just need a prescription, awesome, telehealth, right? Let's do it. But I think a lot of people really want, again, that general caretaker who knows them and they go in for a physical, and especially, as you age into your 30s, 40s, 50, you absolutely need that. And so, I think a lot of health systems just need to find that balance of how do we offer great telehealth and great, ease of access and speed. And also, how do we expand our ability to provide that general care in the way that people need? And again, in the States, there's a pretty significant population of people that may feel that care is relatively synonymous across health systems most of the time. And that they expect that, all right, if I go to a doctor, I will be fixed, I will be cured, I will be healthy again. But where they struggle is with understanding how to get to that right practitioner, right?
Mm.
How to pay for that service. And that PCP relationship or that website, to start transition to talking websites, that website that provides that basic information on making that decision is really invaluable, and I think will continue to be more and more valuable going forward.
And then that kind of comes into the other trend that I've, heard about and talked about and seen in several conferences where, hey, the website now has to be way more transactional focused. It has to kind of be like an app to set an appointment to go pay my bills, whatever, as opposed to being more of a informative kind of hub. And I kind of feel that it seems coherent where if in the future, if I'm kind of trying to figure out symptoms and stuff like that, it's not that useful to have, 600 different health systems writing about that same information about the symptoms, right? Like it's logical for me as a patient to figure that out with a Google summary. But then when I'm ready to say, hey, I got to choose who's going to be, my provider, who's the person I'm going to go figure out, and then I'm going to drill down into these hospital websites, check out the kind of reviews, and then I'm going to do that kind of action right on the website. And do you see websites evolving as becoming smaller, more action oriented, or is there another kind of direction you think they're going?
I hope so. I do think that that's what happens. They become smaller, more action oriented. I mean, there's still a space for health information. I think, yeah, every health system is kind of navigating that. Um, you know, people, people always have questions that need to be answered. And you're right. Like, do you need that basic brain tumor definition? Probably not. But do you need the content that talks about how you're unique and how you approach it, or at least, hey, here is how we approach it, right? Yeah, you definitely need that kind of information. And so, I think there's still health information in the overall strategy. It's deeper. It's about answering deeper questions that are much more specific to how your physicians provide care. Um, and at the same time, right, it's highly structured. It's, there's schema data associated with all content on websites today,
Yep.
going forward, right? And it needs to be structured and, whatever, the infrastructure of your CMS, maybe your DXP, you're able to push that content to different portions of your website or out to third party sites or, towards or into your apps. Like, you want a much smaller footprint and a much more nimble ability to manage the content. Um, when I think then like beyond and like the health information, those same principles apply to that core kind of action oriented content. But I think the foundation of web strategy going forward is really about physicians, services, locations, and having
That kind
that.
of sounds like, in a sense, it sounds like a hospital website becomes like an Amazon for physicians kind of a thing. Like, oh, I'm going to go there. I'm going to, find my physician, click on it, book an appointment kind of. Oh, and I got to pay. Like, it feels like it becomes really like if we push it all the way to that direction, becomes hyper transactional, right? Is that too far, right? In one direction is because at the same time, is it really that? Is that the real purpose? Like there's also the fact that there might be a disaster, like informing, relatives about what's going on if there's some kind of, hurricane or something. So there's all these other roles that the website needs to play. And if we just kind of focus it uniquely on that kind of transactional aspect, then it might be losing some of its value. I don't know what's your point of view on that?
No, I mean, one, it's really important to structure that kind of data so that you can effectively answer the questions people will have. And I think the kind of the thing that's interesting, I think AI will continue to pull as much of this data into its experience, right, as it can, so that traffic never comes to your site.
Hmm.
At the same time, yeah, our footprint gets smaller on the web. It's still the foundation of all the information, whether, they're interacting right on your site or not. I think, yeah, it's too extreme to say that you can, the Amazonification of health system websites. I mean, there are things that make a lot of sense. I think transactionally, like, people will ask more questions that are much more specific. So, you've been told that you need a diagnostic, you need a cholesterol screening or something. They might go to chat or to or to your website, and it's, where can I get an LDL screening near me before the end
Hmm.
of this week, right?
Right.
Like a very specific search. And to provide that data, one, it requires the web content to be structured. It may require an authenticated experience on your website, or more open scheduling against, those kind of diagnostic labs and things that are much
Hmm.
easier to roll out and make schedulable, whether you're authenticated or not. There's those kinds of opportunities that I think health systems just have to move quickly on. And when
For
it comes,
sure. I mean, I really enjoy the authentication kind of position as being one of potentially the trends over the next 3 to 5 years. I think there's a lot of um, risk aversion with the whole HIPAA thing. We didn't get into, tracking the data and all that, but I find it's fascinating that you can log in and you can have all this kind of background information when you're kind of buying a ticket for your airplane and say, hey, here are all the tickets you've taken in the past. You probably would like to do this and this and that, but that none of that is possible on a hospital healthcare website, because there's that kind of huge system in the back, Epic or whatever, right? That's clunky and it works with its own kind of logic. And then there's the website, and there's kind of that huge chasm between them. There's some elements that can connect over, and some work that's being done there, but I feel there's so much potential to have, like, hey, this is my logged in version of the hospital website. Here's your position. Here's the most recent things you've done, kind of connecting all those dots and not just being like a billing portal or a find your doctor portal, like have an integration of all that. So I know it's possible because it's being done in other industries, but then there's all the kind of hoops that you have to go through because of the personal health information and stuff like that, that makes it more risky or touchy or compliance in the healthcare industry.
yeah, absolutely. And so, yeah, you've got to move very carefully in terms of what kind of needs you can meet generally and unauthenticated experiences. And I do think that's the trend, and that you're going to see a fairly rapid shift. And I mean, like one indicator, and not to talk about any specific platform or technology, but I'm going to for a moment. Is seeing Epic roll out broader consumer strategies right now that are still very much about a patient experience. But clearly, for a company like that to be thinking as broadly as they are, and just some of the things they've rolled out over the last couple months,
Hmm.
I think it's at least an indicator of where the industry is going. And that, I see health systems that are doing really cool work around authenticated and experiences, that now those authenticated tools, the EMR, they're making those things real without having to do a lot of custom development. So then what does that free up to, right? What does that free up your team to do in the future, and what kinds of other solutions are now coming? I think it's a massive shift right now.
That's really interesting. Yeah. And I think, and obviously there's a whole bunch of um, real life change management issues with that, was because it's not every physician that wants to give all this type of access, or how's it going to be, transferred or able to connect with. But I think that it's definitely a trend going on. And what would you feel is, like an anti-trend, like, or things that you feel that are like overhyped right now? Like, everybody's talking about this, but like honestly, it won't really make much of a difference. Like it's more of a fad. What do you have any of those that's like top of mind that you feel?
Um, well, I mean, the hype that's most annoying to me right now is the whole websites are dead. Like,
Yeah.
I think this conversation, like, websites are evolving. I hope that they become smaller, right, and much more targeted in their goals, much more transactional and business oriented. And I think, you know, as a result, they're probably going to be more expensive, right? Like as a result of, just meeting HIPAA compliance, right? Having this kind of functionality, there's a different set of costs associated with that. At the same time, I think there are many health systems where the web is going to be understood as kind of a center point of digital experience in new ways, not just brochureware. There's still, or not just health information that maybe is not necessary. Like the work being done on websites will truly be a platform for driving patients, driving telehealth, driving business, and the ability to line up web work with the business objectives of the health system should only improve. And, I think that creates more opportunities as well. When you're able to align with leadership as a result of that, I think it will make, these kind of iterations and evolution that we've been talking about happen faster as well.
I think you're touching on one other kind of, I think that's not so much a trend, but like an ongoing forever thing where justifying or showing the value of marketing work and websites to the executive teams is always a bit unclear. They're always doubtful about like, are you really bringing these patients? Would they have come anyway? And I think that the fact that, right now, what I'm kind of hearing is that the challenge is not so much let's get more patients overall. It could be like specific pockets of services that need to book, and get more, traction. But overall, what I'm hearing is that being able to deliver care, to kind of recruit, be it caregivers or physicians and stuff like that, is more of a challenge for the executive team. And that, since the population is getting older and all that, the demand is going to organically grow. And it's more about how can we deliver that care? Is that a roadblock or some kind of a threat to investing in marketing and websites in general?
I think, I mean, I will say, I think one of the major challenges right now is the level and frequency of executive turnover across healthcare. And you're seeing this in other sectors as well. And you're seeing it within marketing, but you're seeing it among other key C-suite leaders. And that is probably the biggest threat to, the future of any health systems web platform, right? You can create a lack of continuity, a lack of resourcing, a lack of clear direction that can be really problematic. And so, I think about, I look at the pressure CMOs are under right now to demonstrate value, and how in many health systems, like you said, it's taken for granted. Oh, we get these patients anyway. I think there needs to be simpler, more cost-effective ways right now for them to target the right patients and to drive them to the right physicians. I think AI is a big part of doing that, both in terms of how AI will drive certain visitors to a website or to engage with the services, but also within the health systems to understand their patient base more effectively, or to understand where capacity truly exists more effectively. And those shifts, I think, really have to happen in order to truly stabilize leadership in marketing and beyond, so that there is that connection, a clear connection between marketing as a business driver and an understanding of that across the C-suite.
Mm-hmm. Mm-hmm. Yeah, it's easier said than done, right? I, I think, but I understand like what, the importance of that. And it comes down to the strategy and understanding your population, understanding the underlying trends, and kind of number crunching, analyzing that data, which oftentimes doesn't feel quote unquote like marketing stuff, which is usually thought of creative and all these kind of campaigns and stuff like that. But at the end of the day, understanding who we should be targeting, where we should be investing those dollars, how we should prioritize things. I think that at the end of the day is what's going to make or break it. So I'm trying to summarize the essence of what we're kind of seeing, as we close on the conversation. Like the top two, three kind of takeaways or things that we need to consider or that we're seeing as trends. Like one of them was the fact that these websites are getting smaller, more focused, more transactional. I think that's one of them. Another one was the authenticated version of a website. Big EMRs like Epic are moving in that direction. People are wanting that direction as well. There's that. We talked about AI a little bit and how that affected content and everything. And did we identify some kind of a way that healthcare marketers need to leverage AI in the website sense? Did we? I don't think we specifically. Is there anything you feel is important to consider there?
Sure. I mean, I think AI does play a really important role in content creation. I don't look at AI as something to write content. I do
Mm.
look at it as something to help, it's one more tool to generate ideas. It's also, I do think it's a great tool for retargeting existing content.
Mm.
I've seen some great demos using it, as far as CRM and email strategies as an example, so that you can
Mhm.
hyper target your messaging.
Oh, that's a good
So
point.
there's lots of opportunity there.
So, based on our conversation, so we identified a couple of those items. What were the other? What would you say are things that are really important to consider that I maybe haven't mentioned in this kind of quick summary of our conversation?
So I come back to like the core now of maybe a web strategy really is about physician data,
Hmm.
location data, service data, and really thoroughly thinking that through and how you're approaching it, structuring it. When I think of generative search, I think a lot of people are threatened by the activity happening, off their site, understandably. At the same time, AI, those results are highly personalized to the individual who's asking the questions, right? The consumer. They're also going to offer up results that I think are regionally biased, especially the further the questions go down in transactional, nature. And so it's just so critical to have a strategy that, you're providing that type of content and data accurately, consistently on your site and off. And
Right. So that comes back to the structuring the data with the schema, because that's what AI is looking at. That's how it can decipher what that content is on your website. And if they're going to go through ChatGPT to kind of figure out which physician gets so close to the final transaction, then your information from, your whole group should be accessible and easy to read for the AI who's going to recommend, here are three, doctors I recommend in your region kind of thing.
absolutely. And another thing I'd add then thinking, so you asked a second ago about use of AI on your website. I've never been keen on chat solutions, but actually over the last couple years, I've seen more opportunities emerging. And again, there's opportunities if you're focusing in these key areas to roll out chat solutions, more interactive ways for people to engage on your website. And in turn, that is helping you structure your content and structure your data with that in mind. So hopefully people are engaging directly with your tools, but even if they're not, again, you're
Well,
structuring it in ways that, those broader AI solutions out there will likely pull in that same content as well.
yeah, yeah. And we haven't, and I think it's another kind of conversation we could have, but I think there's this kind of blurring of the lines between what's search and what's AI kind of chat. And we're seeing it right now live with Google, right? And I wonder if, because search is such an important part of a healthcare website, because there's so much information and you need to find the right criteria for stuff. But people are probably going to start interacting with a search in the same way they interact with AI. So I think even that idea of a chatbot is almost going to be maybe blurred into the search itself.
Absolutely. It's funny at different points at Hopkins, we were always working on search. And to be honest, I always viewed search as the primary navigation on our
Okay.
website. Because of the complexity, because of all the things you're trying to drive, like you want to make that content experience as sophisticated as possible. You want that search experience to be that sophisticated. I think
Sure.
a lot of, I hear a lot of ideas now about, well, maybe the homepage of the website should just be a chat bot. And that's, I'm hearing others think of those ways. And I don't agree. At the same time, I think you need to be putting the energy and toying with that idea all the time to just say, well, what if it was? Because actually, the majority of users will go, if they're going to engage with your system, if they don't get it on that first page, and they don't get a link, right there, a call to action, a clear next step in that page, their default is to either go to chat or go to search. Today, I would say it's go to search, but so you need to be thinking about that kind of functionality and tool set on your website.
Yeah, absolutely. Wow. So there's a lot to think about. I think, I'm glad that one of your main takeaways is also that websites are not dead, right? They're in transformation right now. And I think that's an important takeaway, at the end of the day for our conversation. But this was fantastic. Aaron, I loved your insights. Thanks for the conversation.
Absolutely, Brad. Thanks again. It was great talking with you.